So when it comes to medicine, but just for simplicity's sake, I just need to point out that I will be using the terms machine learning and AI interchangeably here. If anybody wants to debate about that, we can do that at the end. And also I'll be using the words medicine and health interchangeably. Now let's sit back and zoom out a little bit here. I want us to approach AI in health in a very holistic form instead of just taking a deep dive. Like, why and what would we want to use AI in medicine for anyways? So ever since mankind first made its first tool, fire, we've been on a serious roll of trying to make all our tasks easier ever since. And one of the beautiful things about medicine and the field of health in general is that we cannot do much in this field without bringing in solutions from other fields. And so when the world advances, specifically technology, when a new major tool comes into play, medicine advances as well. When the world stumbled upon steam engines back in the 18th century, we began to mass produce things like microscopes, scalpels, test tubes, and a bunch of other equipment. And what did this mean for the field of medicine? It means research suddenly began to advance really, really quickly. And then during the second industrial revolution, which was powered by electricity, petroleum, and steel, we invented airplanes, the telephone, and so many other things like the sewage system, but we also entered the whole world of prevention of diseases. And this is when the idea of public health first slowly began to take hold in governments. At the same time, though, because scientists were inventing more chemicals and lab techniques, we finally began understanding infectious diseases. So these were two critical advancements in medicine that happened. And then during the third industrial revolution, which was automation and electronics, the WHO was born, along with vaccines, pacemakers, advanced radiology equipment, contraceptives. The whole room for genetics started growing. And now we're in the age of the internet, or the digital age, or the fourth industrial revolution, as some people call it. And it's basically the reason we're all here today. Over the past decade, with the ability to compute and digitize things and make our very boring tasks way easier, medicine has also advanced ridiculously faster. And you've got advances in precision medicine, biotechnology, and so many fields. But one of the main fields that we're here for today is artificial intelligence. And that is a joke. We're not planning to take your jobs. There is absolutely no way. I know that none of you have heard about AI. I'm sure everyone has heard of AI. But what on earth does it mean that we are doing? So although the definition of AI is still under a lot of debate, I'm just going to break it down in the safest and simplest way possible. So first of all, AI doesn't mean robots at all, and nobody's trying to replace doctors, I promise you. From the way I understand it, it's just predictions. We're just trying to mimic how humans think and reach our own conclusions. But AI programs are much simpler than how our brains do it overall. For example, when a patient comes to see us and they tell us they have fever, what differentials do we begin to think of? And I know you guys have been listening so far, but if anyone wants to unmute their mics and tell me the answer. If a patient walks in with just a fever, what's the first thing on your mind? Or like top 5 things on your mind? What are you thinking? So I'll just call on someone. Farhan, I know you're somewhere there.
Yes, I am. Mariam, can you just repeat your question? Hello? Hello?
I can hear you. We might not be able to hear Miriam. Can you hear me, Farhan?
Yes, I can, Megan.
Oh, goodness. Looks like we might have lost Miriam for a second. Let me just send her a message. I do think she was asking, though, if a patient comes in and has a fever, what are the differentials that you would give that patient?
Oh, okay. Well, malaria, some kind of infection.
That's what I would have said, was malaria. But I'm also not a clinician, so don't take my word for it.
We have our usual suspects.
Yeah, all the big ones. Anyone else have thoughts? Also, some of you might not be clinicians like me, so if you're not, don't worry. There's more for you coming.
Can anyone hear me?
We can hear you now,
Yes,
Miriam.
now we can, Mariam. Hello, Mariam?
Okay, so sorry about the technical problem. I can't hear
No worries. Can you hear
anyone
me now?
speaking though.
Hello?
Yeah, technology challenges are real.
Yep. And I mean it's relevant for our discussion because that's what people usually say about use of things like AI in Tanzania, right? They're like, we can't even get a Zoom to go without interruptions. How do you expect AI to work? So yeah, it's all case in point.
Yeah, you want to know what our response is that if we can build the tool offline so that you don't have to connect to the internet, is that a better solution? Is like what we always ask people. And we get mixed responses. You can build a tool that doesn't use the internet? Yeah, maybe.
Okay, here we go. Sorry, I'm so sorry. Yeah. Farhan, you were saying something.
No worries, Mariam. We had a
Welcome
whole
back, Miriam.
discussion without you.
Oh, well.
Yeah, so as you know, I'm in love with malaria, right? So my first suspect would be malaria.
Okay. And then what would you do? Or what do you think doctors do?
Order for a blood test.
So anyone else wants to just chip in and think of anything else they might be thinking before they take a blood test? Okay, so if it's not malaria, you could also think, oh, pneumonia, and you would ask the person, oh, do you have a cough? Now, while you're walking through this entire symptom assessment and you want to reach a diagnosis, before you order any blood tests, do we know that it's malaria? Like, can you see the parasites inside the blood jet before you do any investigations? You can't, right? So right now, do you know that this patient would be having malaria, or would you be predicting that this patient might have malaria? The idea is that it's predicting, and that's just AI. It helps make predictions. Now, you are able to come up with differentials because of one thing. Yeah, doctors come up with differentials because of one thing: data and some experience. We were fed data when we went to med school, so now you have some differentials. But as you're treating the patient, and let's imagine it's a real patient here, you find out that, oh, the person doesn't have malaria, they have something else that causes fevers like lymphoma. So now, while you're treating that patient who has lymphoma, you now have a much better experience. And when you next see a patient with a fever, that experience that you had previously, plus the initial data that you were fed during med school, will help you approach this patient and diagnose them even better. And that's just AI. When we make an when we make an AI program, we just create the math and the laws that would drive these predictions. So that's AI. We're just all really one good natural AI thing called human beings. Now, we've understood that there is one very important tool that's driving medicine right now, especially in our continent and in our country, which is AI. And remember how we said that technological revolutions have been driving medicine and impacting patient healthcare? So do you think that we can solve and implement AI in health in Tanzania to solve healthcare problems? The healthcare challenge in Tanzania is very broad. And as of a few years ago, the ratio of doctors to patients in the country is actually 1 to 20,000, where 75% of these physicians live and work in urban areas, as we know, and they serve only the 25% of the population. The remaining 75% of the country's population live in rural areas and is left with only 25% of these physicians for the rest of the country. And this causes a serious problem when it comes to diagnosis, when it comes to access to investigations and so on. So what are we doing? Now, a bunch of very, very, very caring and super intelligent people that I happen to work with, and they'll introduce themselves in a bit, successfully created and deployed an AI-powered tool to help healthcare workers in primary health centers in rural areas to make better diagnostic and treatment decisions. So guys, meet Elsa Health. Elsa Health, meet medical community.
Yes,
Megan,
hello,
I'll let you
community.
introduce yourself and just take it away.
Sure. Yeah, I've been kind of chatting briefly, but I will introduce myself before sharing a little bit about our work that we've been doing at Elsa Health over the past couple of years. So my name is Megan Allen. I think I've met many of you on this call, which is awesome, or if not, we are friends on Twitter, which is great as well. I run operations for Inspired Ideas, which is the company, the larger company that works on the Elsa Health projects and has been spending the last couple of years working on Dr. Elsa. And I'm super excited to be here with Miriam today. She says we're awesome, but actually she's the awesome one. And I'm super happy that she's getting to lead this session. So Miriam, maybe you can go to the next slide and I can just share a few things. Oh, I already did that. So what are we up to at Elsa Health? If you've ever seen any of our presentations or any of our work on social media, you of course know that what we're up to is about building our version of the future. We're about bringing health and technology together in new ways that help change how healthcare is taught, learned, practiced, accessed, right, created, all of the things. And as a group of technologists and clinicians, we're very interested in figuring out how we can actually work with the community, both the technical community and the clinical community, to better understand how we can create tools and products and services that actually make a difference for people, right? Because like Miriam said at the beginning, what AI is meant to do is to inform human decision making, and we're really about figuring out how we can actually provide that in a service or a tool or whatever to clinicians at the first point of care, to patients who are sitting in the hospital or in their homes, to researchers who need to better understand the data that they're dealing with, right? There's lots of speculation about what AI is and is not, but like we're really here to find actual solutions that make a difference. So we've created these sessions as a way to connect our awesome community of health providers and developers in Tanzania together. We've created these sessions to just talk about AI and talk about health. This first one is a lot of us speaking at you potentially. Hopefully at the end we'll have some engagement. But in the future, you know, Miriam and I did a lot of brainstorming about what we want these sessions to be about, and we want you guys to just be able to come and say, I want to learn about X, and we'll figure out how we can, you know, learn about that thing together. We of course want to build things that are useful for the medical community and get your ideas and feedback about how we can continue to do that. Perfect. So just to share a little bit about one of the aspects of our work. So we're talking kind of about this broader idea of artificial intelligence in healthcare, which can encompass a lot of different things. It can encompass a lot of different tools or products or services, right? And it all comes together ideally into a set of tools or a platform or something that we can deliver to people to actually make a difference. And one of the ways that we've been doing that, one of the things we've largely been working on over the past couple of years, is this idea of something called the Elsa Health Assistant. So like Miriam said at the beginning, right, how can we teach the computer to take all this data and maybe some of the experience that many of you have as clinicians and have it be able to inform decision making at a first point of care at a hospital or something like that. So we've spent the last couple of years trying to figure out exactly how we would do this. And I think Miriam will share a little bit more about that later, but essentially our Elsa Health Assistant is a tool that uses data, machine learning, and expert knowledge. The expert is Miriam, just in case you guys were wondering, to provide things like symptom assessment, diagnostic decision support, next step recommendations, risk analysis, predictions for dropout of antiretroviral therapy, et cetera, right? So we're slowly trying to expand this idea of an Elsa Health assistant and figure out how much we can teach it to put it in the hands of a clinician to help them with their decision making. And just to review a couple of the projects that we've kind of been working on and some of the use cases that we found AI in healthcare really makes a difference. The first one is in pediatric care, particularly because Tanzania doesn't perform super well on neonatal or pediatric care outcomes. It's getting better, as many of you know, but we really think that this is an area where if we can make sure that kids are getting diagnosed appropriately, that they're getting access to the medications that they need because of that correct diagnosis, et cetera, then we can be able to support their health outcomes. Another one is cervical cancer, which we actually did a project on a number of years ago, but we've been able to teach the computer how to do cancer risk assessment for cervical cancer, even without an oncologist. So we trained on some data at Ocean Road Cancer Institute in Dar, and then deployed in a rural village to test whether or not we could accurately predict cervical cancer risk. So that was a fun and interesting project. We focus a lot on non-communicable diseases, which are of course on the rise in Tanzania, hypertension and diabetes, figuring out how we can predict whether or not a patient will either get one of these diseases in the future or will progress to more severe disease in the future, et cetera. And then one of our big pushes right now, which if any of you know me, know that I care about, is sexual health and HIV. So we have a big project happening right now across 5 districts in the country, focused on how do we do better HIV symptom assessment for late stage AIDS? How do we better predict when people are going to drop out of their medication? How do we better predict if people are in virologic failure and need to change treatment regimens, et cetera, et cetera. So that's some of the work we've done so far. And I think my last thing I just want to share is what our goals are, which this is coming from us, but really we'd love to hear what other goals you feel like are relevant and important for our work. One of our first goals always is to figure out how we can put this specialist level information in the hands of healthcare providers and patients all over the country to help make better decisions. One of our goals is, of course, to build the digital backbone of the healthcare system. As all of you know, there are lots of mHealth movements and kind of technologies being deployed. There's of course government level technologies that are being deployed both in private and public hospitals for EHR systems or something like that. But we really want to be able to help build that backbone as well as be able to support the decision making around it. We have a big goal to decrease misdiagnoses across the board. There's been some interesting articles about how well, not to say anything about any of you, how well clinicians at first points of care are able to diagnose patients based on a number of information, as well as what they're dealing with in that moment, right? People who are tired tend to make worse decisions. So how do we help kind of be able to fill in the gaps and augment healthcare provider capacity when it's needed? We of course want to increase healthcare worker credibility and confidence, which is something we've heard from people who work at lower level institutions or ADOs or dispensaries. They've said, this tool helps me build credibility because I'm getting it right more often, or because I know more answers to something or whatever. So that's been really interesting. And lastly, of course, we want to improve health outcomes. So I think that's my piece, and sorry if I spoke a lot at you.
Thank you so much, Megan. That was so wonderful. So one thing I'm always excited about telling people is, what's the Elsa process like? How do we go from what we want to do, making the models, all the way to deploying and then analyzing all the data? So when creating these so the first thing is you have to input some initial data into them, which is sort of like taking Elsa through med school, first, second, third, fourth year. And we call these things disease matrices. And when creating these disease matrices, it's important to keep in mind 2 things: how the model will be developed. The language that I use as a clinician isn't the same as the developers use isn't the same language either. And neither is the thinking process at first. So most of the time we end up just teaching each other new languages, which is very fun. And the second thing is that numbers are very, very important. AI works a lot on numbers. Prediction is just numbers. So when I say numbers, I mean the probabilities of everything that leads up to a differential before you do any investigations. So it's important to give the developer, which is just Ali, the probability that someone with TB will present with a cough, for example, or the probability that someone with TB will present with a fever, for example. In med school, we're taught like these symptoms sort of are at the same level, but they're actually not. And this is something that we also do, like as clinicians, we do this very automatically in our minds because of all the experience we have. But to train Elsa, she needs actual numbers. And so a lot of research is involved. And by the way, when I do this research, you end up noticing that Tanzania has so many gaps in our research and in our numbers. So that's just something I like listing down as I go along my work. When developing the models, all of these probabilities of symptoms and signs and differentials, think of it as an entire network. And that kind of brain network in computer science, we call it a Bayesian network. You don't have to know this, but it's a pretty cool term. Then once the first models are developed, I do a quick internal testing where I just input simple patient information. It's not really real, it's just from my experience or case studies, just to see if the models make sense and they aren't saying anything weird. And after that, we go through an evaluation process. Sometimes this validation process happens while we deploy Elsa. And one of the ways we evaluate the models is through agreeability with healthcare professionals. So for this process, we recruit like 20 doctors to look at a set of generated patient data and they provide their expert advice on the top conditions that this patient is likely to have. And then we average those decisions across the physicians, and then we compare that with the output that Elsa does. And this provides us with an agreeability score, which is a very interesting research. And then sometimes we validate this, as batches as we deploy Elsa. So yeah, fun times. This is just like a quick look of in-depth of the Bayesian network that I was explaining. And this is like we don't really need to know the main details of this right now. One of the things that we have to consider while we're doing this is that while we're creating Elsa, we have to be transparent to the healthcare workers and other stakeholders, which means when we're creating the models and when we're actually making the models. So does anyone have any questions about Elsa Health right now? Yeah, Issa, you can unmute yourself.
Can we have a demo?
Megan, can we have a demo?
That's a question for Ali, not for me.
I think we can definitely do that in the next session, or you can come in for a demo. Yeah.
That's a good idea. And for anyone who would want a demo, maybe Miriam, that's something we push to our next session, and we can work with Ali to get something, up that people could see and interact with even. Yeah, that'd be really cool.
For sure. Okay, so no questions. I'm gonna wait for 10 more seconds. No, 3.
So, Mariam, I have a question, but it's more about the digital, health infrastructure and all that. So maybe I can ask that later. Or do you want me to ask it now?
Well, I think that would lead on to our next discussion anyway, so you can go ahead. But let me just ask if anybody else has any other questions. Three, going once, going twice. Okay, no questions. So Farhan, your question sort of leads into this that we wanted to talk about. What excited you and what is everyone more excited to learn about? And it sounds like you're excited to talk about digital infrastructure. So go ahead.
Well, so now that I think about it, maybe my question is related slightly more to Elsa Health. And what I wanted to ask is, and you guys have given like your objectives, your aims, and what you are planning to do. I just wanted to ask, is sort of advocating for digital health one of them? And the reason why I say that is because all these digital things are great, but we know there's this whole question around enabling environment, right? Is our government ready? Are all our stakeholders ready? Because I've had some conversations about AI with certain government agencies, for example, and there's always this apprehension about are we ready for it as a country? Is it something that's truly useful? And I don't know who exactly is playing the role for like advocating for this and ensuring that the right stakeholders are getting the right kind of information. So I wanted to ask if you guys envision that as a role for yourself, or is there someone else that you see playing that role? Because I think it's really important. Without that sort of enabling environment, it would be very difficult to implement some of these uh, suggestions or solutions rather.
Hi, I have a question related to that, and sorry, I wanted to ask this earlier, but I was having trouble unmuting. So my question was around what is the current status of implementation with Elsa Health or Dr. Elsa? And how do you see, are there any challenges, and how are you moving forward with that?
Yeah, really good questions. Miriam, feel free to add in whatever you think, but I'm happy to take a stab at both of them really quickly. Farhan, to answer your question, this is like, it's so important. And I actually just sent Miriam a message and was like, we need to talk about this in future sessions, right? Like have a whole session about how do we build enabling environments for digital health or for AI in general. I think when, I have to admit, when we first started, this probably wasn't on the top of our list. It probably wasn't like, yes, we need to get the whole country on board and have, make sure all the stakeholders are aligned, et cetera. But I do think that over the last probably 2 years, or maybe like year and a half, we've really tried to figure out how do we communicate effectively about our work and about AI? Because I remember in 2018, the beginning when we first started, I went into a meeting with a regional medical officer with Ali. And for any of you know Ali, he's the CEO of Inspired Ideas. And we went in and we said we were going to do AI in healthcare. And he literally looked at us and was like, ha ha ha, bye, like you can leave. And we were like, what? And he's like, nope, we're not doing any of that. That's robots. You're going to take our jobs. We're not doing it. And we were like, okay. So from there, that was our first bad kind of experience. And maybe it was just one bad apple. Since then, we've met lots and lots of people who are, in positions of power or stakeholders who are interested in AI in healthcare. But I don't think, like you said, Farhan, it's not like a wave that sweeps the country where everyone's really excited and ready to onboard any tool that exists, right? So I definitely think in future slides we'll add that like building the enabling kind of environment for this is something that we're working on now. It's something that I've also recognized we need really big, and strong partnerships for. So literally it would turn to all of you, like all of you who are interested in this work or whatever, to be advocating for these sorts of digital technologies, where you work, where you practice medicine, whether you're a developer or whatever, to be really like sharing about that, I think is important. And then, we've had over the past maybe year or so, there's been some movement in terms of like discussions about shifts in policy, as well as like engagement from a government level with things like the focus group on AI for health, which is a WHO ITU collaboration. If you don't know about that, we serve on one of their committees helping to figure out how we can benchmark AI tools around the world. And one of the sessions was hosted in Zanzibar last year, I believe. So there has been some recognition that AI exists, and I think it's really important to continue building that over time. So that's my answer to that. And like I said, it would be cool to maybe, talk about this further and bring some additional people in the future. I think Harrison, you had another question just about the current status of Dr. Elsa's implementations as of right now. So right now, kind of where we're at is we're in this testing phase, like piloting phase, essentially. We've deployed over the last 6 months or so We've deployed in a number of locations, and we're currently in the process of deploying out across five districts in the country. A majority of our deployments are in dispensaries or health clinics. So some place that's kind of small, only serving, probably 50 to 150 patients a day, not much bigger than that. Our first deployment ever was in Arusha, and then we did another one last year in Bagamoyo. And this year now will be in Arusha, Bagamoyo, Mbeya, Morogoro, and Tanga. So slowly starting to expand our reach a little bit, but still mostly focused on serving the kind of like smaller health clinics initially. And all of this is in testing and piloting. And I think maybe back to Farhan, your point, there's a really important aspect for us to be able to say, we did all this piloting and here's the results, right? Because we could all be wrong and like none of this is actually helpful and useful, right? And if it's not helpful and useful, then we need to know that. And the only way we can really know that is by piloting in the places where we want to work. So I think I'll get off my soapbox now. Thanks, Miriam.
You're welcome. I wouldn't add anything to that. That was perfect.
Thanks a lot for that, Megan. I think just one, sort of idea to throw there for you guys to think about, or for all of us to think about rather, is that, how I think with our government or with our ministry rather of health, one thing that I have seen work very well is the idea of, technical working groups. We have a family planning technical working group, we have a child health technical working group, HIV technical working group. I wonder if there's a digital health technical working group, and I wonder if that is something that we need to work to advocate towards, because I think that then will become a platform where different sort of stakeholders can come together and share what they're doing. Because I think in my experience, one of the biggest challenges in Tanzania is a lot of work is happening, but it's happening in silos. And because of that, we never really have a united front for some of these things until sort of, and things get missed out, there's duplication. So I wonder if that's something that needs to be pushed for, or already exists maybe, but we don't know.
Absolutely.
Okay. That was a great discussion. Does anyone else have anything? Yeah, Isa Mshani.
Yes, good morning, everyone. Afternoon, it depends where you are right now. I just want to have a quick question. I would like to know, I think maybe you can answer it in the next session, or if possible, you can give it a clear explanation right now. What is your source of data? Do you get the data directly from the hospitals, or I want to know the source of data for the previous work which you have been done. You have said you're piloting something right now. So I would like to know the source of data.
You mean the source of medical data?
Yes, yes.
Yeah, sure. So it's a lot of research involved, so a lot of research online, and also because of my experience, I already have an outline for a lot of the diseases, because of my training, of course. And then on top of that, I also do extra research. So that's a lot of reading journals online and everything. And also, I never leave out calling an expert or a specialist, just to clarify all of the things that I do. Does that answer your question?
I have something I can add as well.
And also, yes, I take into account the Tanzanian guidelines while I'm doing that.
That's important. So I also can share a little bit as well. So besides all of the massive amounts of work that Miriam actually does to research a lot of these things, there is sometimes in cases where we're able to find, clinical data or something like that. Sometimes we find clinical data sets that are open and available because people did research or whatever, right? And then they've published those things online. So for example, some of the work we're doing in HIV adherence, there's actually a lot of published data sets online where people just freely kind of make them available, and we get to credit those people for the work that they do. And then I saw in the chats that you are also from Ifakara Health Institute, which is interesting because at Elsa we have a partnership with Ifakara Health Institute, And it's also one of the places that we've been able to partner with researchers in order to get some data.
Okay.
And just also to share a small plug, one of the things we're hoping to be able to do, so data is of course a big issue. And you know, we can only search for so much online or try to find stuff that's already been collected. And one of the things we're thinking about trying to do now is setting up and running kind of smaller pilots in facilities specifically just for data collection that can then be used to train and inform our models.
Okay. Yeah, thank you very much for the nice explanation. You know, from my knowledge concerning IA and machine learning, it's very important to be careful with the data. Which data do you train to the algorithms? Because, you know, we have different patterns in data, depends where we get the data. For example, if you get malaria cases in Arusha, could it be different to malaria cases which we get in Morogoro, for example,
Yeah.
based on symptomatics and so on. So I think we could have two sessions. The first sessions is just to prove to the government officials that our systems could work. And then the next session is just to increase the data set so the algorithms can capture information from different areas, can capture a lot of information into our data so that we can have an algorithms or a system which is perfect compared to that. Another issues I would like to just brainstorm with you together is just the issues of taking a job of doctors and maybe other healthcare professionals. You know, it's inexcusable to do that without taking some cases. For example, here in Ifakara, we are trying our best to develop a malaria diagnostic tools using artificial intelligence and machine learning in order to just try to come up with simple methods, cheap one, just save time, cost effective in malaria diagnosis. But you know, what's the side effect of that is just 100% we take jobs of professionals, specific lab technicians, because we have symptoms analysis. Someone, for example, as you have explained here, doctors may try to get the symptoms decisions, which kind of diagnostic tools he can use. It's just a kind of advice. The system could give an advice to the doctor which kind of diagnosis he's supposed to do based on the symptoms or to the clinical history he have been given by a patient. But we have someone who is in the lab. His work is just to diagnose maybe the blood test, or maybe to do a tuberculosis test, or to do anything else. But we have a lot of systems which help directly to say if someone is malaria positive or malaria negative by using IA. So automatically we take a job of the person who is in the lab. So that's my key observations based to what we have been discussing. Thank you.
Yeah, interesting point. So just about the geography thing, that's a very good point, and we do take that into account. Like malaria in Arusha would present slightly differently, or would be in different numbers than somewhere else, like in Morogoro, for example. So that's a good point. About the part about taking jobs, so the whole point here is that we wouldn't be taking jobs, but rather think of it this way: the lab technician in that lab, instead of just diagnosing TB and malaria through the normal methods that we've been doing for the past like 25 years, he now has the opportunity to do more research and to advance medicine in that way. And I know Isa wants to contribute something here.
Yes, and also to my understanding, what Dr. Elsa is targeting is deployment in areas that do not have those professionals specifically, where there's a lacking of those professionals, such that there won't really be a replacement of any jobs or any individuals because those individuals didn't exist there in the first place. So it's more of just complementing whatever already exists in that particular rural ecosystem and developing the facilities there in more sustainable and hopefully cheaper ways, even if it's not attractive to a person, maybe because of salary or whatever. A machine isn't going to complain about, an algorithm's not going to complain about a salary. So that's the way I understand it.
Yeah, good
Mariam,
addition.
if I can contribute slightly to that as well, I think this debate of whether or not artificial intelligence is going to take people's jobs is something that's going to be around for quite some time. Because I mean, you know how human beings tend to be, right? Like to Isa's point that he just mentioned, right now no one wants to go to those rural areas, but I bet you the moment you start sending robots there, people will suddenly feel insecure and will start applying for those jobs as well. So it's I think, and this is why I said there's a lot of advocacy that needs to be done. So not just at the government level, but even to health professionals. And I wonder if something that we also need to discuss in the future is what the role of a health professional would be vis-a-vis what the role of artificial intelligence would be, if there's a way that we can specify that. Also, I think discussions need to happen around, because this is happening in other sectors as well, not just in health. But so if, for example, AI does take the job, or the typical job description of a lab technician, for example, is there something else that the lab technician can do instead? So to give an example, I remember being in a discussion where they were talking about how, you know, how we are now talking about driverless cars, right? That drivers will have cars to, they won't be, because this whole discussion around, okay, so the people who used to sit in the cars as drivers, is there something else that can they do? Can they give a foot massage to someone as they're going from point A to point B? Now, of course, there's probably a lot more thinking to be done on the health side because it's a more technical area. But I think the discussion needs to elevate to that rather than just defending AI and saying, oh, it won't take your jobs, but insecurities will remain to be insecurities. So maybe we need to think about that slightly differently.
Yeah, I just want to jump in here and comment. I think, yeah, this discussion is really interesting, and I just took a couple notes for even future sessions we can have about, you know, coming up with some ideas maybe for how we talk about whether or not AI tools will take doctors' jobs, or anyone's jobs for that matter. But Farhan, I think to your point, there's a much deeper discussion, and definitely what we've recognized is that by saying like, no, like we're not doing that, right? We're here to help. We're here to help. We're here to like inform your decision making. They're still like, yeah, whatever, right? And when kind of mass media and punchy headlines means that people get to say things like, this robot's going to take your job, then everyone starts to get really scared and kind of fearful about what's actually happening. So anyways, I think that's a really good point. One thing we've always talked about, which I think is interesting, and I have a article on, is that it says AI will give your doctor superpowers, which, and the article talks a lot about how we will, you know, kind of improve the decision-making capacity and capabilities of healthcare providers, but there's no way that we could replace them or take their jobs. And if any of you have ever read Deep Medicine by Eric Topol, or if you haven't, you totally should, he also makes the same argument that there's like actually no way that we could replace the type of like patient-doctor interaction, but we can instead take away some of the decision making or some of those kind of monotonous tasks and have AI do them potentially better in some cases. So.
Yeah.
Yes, thank you very much. I could like to add just one point there. You know, this is something very clear and it's very interesting point of view that Dr. Elsa is doing. I would like to point one thing. You know, when we referring to advocating the system, the medical care systems based with digital technology, specifically artificial intelligence, could it be very difficult when we think on how can we advocate it. But it's very important for us right now to focus on development of the system. You know, it's very important to understand the data we are using, how the algorithms learn, and what does algorithm learn, so that when we advocate it, it could be easy because we could have a perfect system which do better than a doctor, for example, who do better than a technician. You know, the biggest problem here is sometimes we can have an algorithms which we may think it points out or it predicts our point of interest, but on the background, the algorithms do something differently. And that's why I was asking the first question concerning the data source, for example, where the source of data and where the data coming from. For example, we have some people who from Oxford, for example, who they're doing some works here in Tanzania in medical entomology using IA into some cases of medical entomology. When we refer into entomology, because we are dealing with insects, it's very easy compared to when you are dealing with a human being, when you're dealing with healthcare professionals, because we have a lot of ethics in healthcare. We have a lot of rules, regulation, guidelines in health diagnosis, and so on. So I would like to point out that it's better for right now to focus on the development of this system, which is the perfect in prediction. And we are supposed to be sure that what the algorithms learn, what the system learns in the background. And we can be able to do that if we'll combine at early stages the involvement of healthcare professionals, the people who know the real biology of the data, and the people who know the real mechanism of algorithms. They supposed to come together and come into a point of a conclusion that the biology of this data is directly to the cancer diagnosis, for example, and the mechanism for algorithms is direct on prediction of cancer, not something else, for example. So that's what I would like to point right now. Thank you.
Yeah, so it's like you took the words almost out of my mouth, like what I was going to go to next, which is, and I think, like you said, partnerships between medical professionals and AI practitioners is really important in both advocating and improving the models and making sure that we don't make any mistakes like the ones you were talking about. And so therefore, one of the reasons why we're doing this community engagement program is so that we can ask the medical community, people who are interested in this, if they would like to be a part of creating our models or part of our validation process, or just even researching, because there is just so much that still needs to be done. And if anybody has any random thoughts to throw on that, like, for example, would anyone from here want to spend like 2 hours a week in just helping us or being a part of the process?
Tried to raise my hand, but I can't figure out how to raise my hand. Oh, I used the wrong one.
You clapped.
Anyways, I was saying I would help you. I'm not very useful, everyone, in that, but I will help the best I can.
I think you've been helping a lot. In fact, I think that's your job description.
Help people.
Yeah.
I did have, I'll give you a second to chat. Miriam, I have a one question. I don't want to take a ton of time because I know we're kind of running out, but maybe after this I can just bring up one small question about explainability of models.
Sorry, come again? I did not hear the last sentence.
Oh my goodness. I was just saying I wanted to bring up a question about explainability of models, but we can finish this part first. And Isa, I think, had something to say as well.
Isa? No? Nothing?
Oh, nothing. Just like I would like to involve in both models, validation, researching, everything there.
That's awesome, Isa. Cool. I'm sure for most of you, we'll just bother you on Twitter as well.
Yeah. I think we have a couple of medical students here. I don't know if I should can I just pick one?
Sure.
Okay. So is David here? Yeah, David Joseph. What year are you in?
Okay, thank you. It is a nice list, by the way. Now my input is, when we are working with these technologies, and in our country we have not yet deploy them to that maximum. And a lot of advocacy is needed so that create that awareness. Now, my input was if we are dealing with something which we are going maybe to use after some years, because the issues of machine learning and artificial intelligence in healthcare, we know our systems are very stagnant, and the systems are conservative to accept these new technologies like the kinds of genomics, bioinformatics, and other emerging technologies in healthcare. So the system is very stagnant, the system is conservative, but still the technologies are very disruptive. And when I say disruptive, it means when we are deploying them slowly, it will reach a time when the systems will accept them. Because we see in developed countries like China, they are using AI in diagnosis of some diseases, and it is very helpful. But our problem is maybe we are very conservative, or we have very low compliance to these technologies because of the regulations in the healthcare. Now, the advocacy is should be based in the grassroots level. Nowadays, we should not focus more in the medical doctors or the health practitioners who are practicing right now, but creating awareness in the grassroots level so that we create a generation of healthcare workers who are really aware of these technologies, so that we can increase the compliance when the time of deployment comes, because we cannot wait until 20 years so that we deploy these technologies. It's better we start over from the grassroots level, so that when the time of deployment comes, now you find the generation which will be existing at that time is already aware of this technology. So I think the advocates should be active in the grassroots level, in medical students and the students taking health fields. It will help because we'll be creating a generation of health practitioners who are well aware of the impact of these technologies in healthcare, so that we can have an improved health outcome.
David, yeah. Also, I was just over here clapping the whole time, like, yes, yes. I couldn't agree with you more. I think that's one of the things we're trying to do at Elsa is figure out, even though we might not have all of the ecosystem put in place or the policies put in place, like how can we start pushing that? And how can we do it at kind of a small level to test our tools, to validate them, to make them better, right? How can we get them in the hands of people like you guys, especially people who are med students and who are, just getting into their practice, and have them start using them from the very beginning of their work, right? So that we have like a generation of people that grow up using kind of AI tools in healthcare. So I think you're absolutely right. And I'd love any of your, like in the future, any of your insight, if you'd love to help support or even test out the tools to see if they'd be useful in your setting, I think that would be really helpful.
Thank you.
Amos, in the someone's saying that in the chat they would like to participate on researching. Amos, what field are you interested in?
Hello.
Hi.
Hi.
Yeah. So, what research field are you interested in?
Sorry, I'm not yet on the researching on the how effective the diagnosis they are within the device what we are going to deploy within the doctor. First of all, I'm a medical student, so within 2 months I'll be graduating, but I would like to participate in researching on how the tool works, and how collect the diagnosis upon the receiving the clinician there at the peripheral inputting their symptoms, reaching to the correct diagnosis.
Cool. Megan, I think we're seeing a lot of people really interested in the validation overall.
Yeah. Yeah.
Especially
Super
from
cool.
the conversations.
I love it.
Okay, that's all. That's all. I'll be researching on it and doing the research on upon. I heard about the Tanzania treatment guideline. I think the 2017 guideline is going to be phased out because it's like some of the things because I've I have hand-on experience with that guideline because I'm doing one of the research. I'm using that guideline, so I think there are some things need to be changed there. So we should be looking for the other guideline within the East African or some of these big hospital like in Mwimbili, they have their own guideline upon treatment of different kind of diseases. So we can rely on them rather than relying on the government guideline because the government will not update day to day their guideline because it can range from 3 years. There they came to update again. So I think that's one way of providing the good device which help them to reach the diagnosis and the treatment, effective treatment of the patients on different conditions like neonatal, pediatrics, coming to the cancers. So depending on the institution that have more experience on that kind of disease like ocean road, we can have the better capturing of the symptoms and the diagnosis of the disease.
Yeah, absolutely. I'm glad you brought that up because that's just one of the other things that AI can also do is to provide like an output of data to give you better recommendations and a better guideline based on the area that you're in. And there's already a lot of research that began on that in the US, but that was like more than 10 years ago. So yeah, stuff, and we will definitely reach out to you after this.
Okay.
Yeah. So how can the medical community get more involved in our work? We are going to be holding more sessions on community engagement. More future sessions, and we're thinking of having them at least like perhaps once a month. Also, remember how I talked about how I have to lay out the diseases for the developers in a certain way? I'm also willing to like have people contribute towards that. And in doing so, for example, medical students will see the kind of research gaps that we have in our system, and they can do their own research work as well. We're also thinking of having our own WhatsApp group where we can talk more about this stuff. And also we can have, so some of the things that you brought up were the validation of Dr. Elsa. So you can also help validate our models. We'll definitely be reaching out to you for that. We're also thinking of having like sort of hackathons, future competitions kind of things. And also we would just love if you could just give us regular feedback, if it's even on social media, if it's through emails, and just spread the word. And yeah, we will definitely be sharing some articles and podcasts. So yeah, thank you so much everyone for coming. If there are any final questions, just unmute yourself.
I'm just going to say what's happening in the chat because there's lots of things. I, like Miriam said, either we'll make maybe like a WhatsApp group, although I know many of you have lots of WhatsApp groups, but it might be fun to have like an AI and health one where we could share thoughts and ideas, or I could send an email thread because I've mentioned a lot of books and podcasts and stuff, and I know Miriam has a ton as well. So we'll make sure to connect all of you and share those things, and feel free to add whoever you want onto that thread.
I think Isa wants to say something.
Oh no, Mariam, I don't have.
I meant Esa. Sorry, there are two Isas on this.
Call me Skynet.
Okay, Skynet.
If the chairs will allow, regarding the stakeholder comments that was brought up, there's actually a program coming up which aims to bring together the stakeholders in the health and well-being ecosystem to first start with the identification of existing challenges and then move towards challenges that could potentially be solved by artificial intelligence, assuming that we also have the necessary prerequisites. So that program is what we are calling the Idea Lab. Okay, so I've been told I may need to introduce myself again. Okay, my name is Isa, and I am currently the community manager of the Tanzania AI Lab. Some of you may have heard of it. And I'm just bringing this up due to the stakeholder comment, and if and inspired ideas will probably be there for this session. So it's going to be bringing together the stakeholders across the health and well-being ecosystem to identify the existing challenges, and according to the challenges brought up, look at which could potentially be solved with artificial intelligence, and work towards creating open source solutions that could be implemented according to the challenges brought up. And that's the project you may have seen that we've called the Idea Lab. And that may be of interest to some people who want to work with the stakeholders and engage to create these types of open source solutions.
Inspired ideas will definitely be there, Isa.
Thank you for the invite. Yeah. Okay, yeah. Just one other thing I want to add is that after we finish this session, I think, Megan, we should send out a form, the one that we had done for the specific disease areas that we were thinking community medical professionals were interested in finding out more about and just wanting to see eradicated. So we will be sending a feedback form plus another form for that, or just one merged form.
Perfect.
Yeah. Any more questions or any final comments? Anyone? Thank you, Skynet, for your social media handle. Okay, that's 1 hour exact. I'm proud of myself. Thank you, everyone, for coming, and we look forward to interacting more with you in the future.
Bye, everyone. Thank you.